Hello, hi. Welcome to the panel discussion on Voice AI era in India. Really happy and amazing to be part of Huddle Global and for mentoring this particular fireside chat session. This is with a friend. This is not going to be a technical session. This is a founder-to-founder chat on how we both landed up in Voice AI space, the learnings that we have when we built out in this space, the things that people talk about, what's the hype, what's the reality. So really welcome all of you to be part of this amazing session. So Voice AI, and this is something that we hear every time we open LinkedIn. There is like 101 demos that we see every day of Voice AI agents speaking flawlessly to the customers, interacting amazingly. It almost feels like it's science fiction. But today we both are here to say that it's amazing to see that, but it's not the reality. The reality is a little bit different. So in this session, we'll try to poke holes with what we have seen and observed when we built out these voice agents for customers, what their feedback was, what is the hype, what is the reality. So I'll start this session with a brief introduction about both of us. I am Neethu. I am the CTO and co-founder of SuperBryn, where we build, evaluate, and monitor voice agents. Me and my co-founder Nikita, we recently finished our fundraising round. We're happy to announce that we finished a pre-seed round of 1.2 million. And I believe that's an amazing thing. We have a company within Kerala, and then this is an amazing stepping stone for us. I'll ask Dhruv to introduce himself, Dhruv Mehra. He is the CEO and co-founder at Pype AI. So Dhruv, briefly, what does Pype AI do?
Hi, Neethu, thank you. Pleasure to be here. I've been interacting with a couple of amazing people here, so absolute pleasure. I'm Dhruv. Pype essentially is a healthcare company. We are building, very simply put, we are building AI call center for hospitals. Now, of course, that's an oversimplified statement. Pype helps specialty doctors in delivering the right patient care, which their patient deserves, but because of constraints on staffing and resources, they can't. So that's where our AI agents step in and help them amplify their care. So that's how I would try to summarize it.
Amazing. I want to start with something super simple and then something every founder remembers. The first time we showed a product demo to another potential customer. So, do you remember the first time you did that, and what was the feedback? What was the oops moment, and what was the best thing about it?
I would say there were two moments like this. First one, when we started, we weren't necessarily a healthcare company. That was the realization we had over a period of time. But the first aha moment for us was when we built a voice bot, which was just a typical AI agent. And we roll out a loan dispersal campaign for a POC. And when we dispersed first loan, that was like a moment for me where I knew that this was something I could not have done, but AI agent did. So we were like, there is something in it, probably we should go ahead. Similar moment when we pivoted completely into healthcare. That was more of an emotional moment when one of an elderly lady started crying after talking to our agent, mostly because I'll come to it like a little later, but these agents also have like a psychotherapeutic value to them, which we'll probably cover later. But that lady started crying because she thought there is someone who reached out to her when like no one was there. So that was another moment for me, which kind of made my resolve that this is something I can do for the life.
Amazing, amazing. Touching upon that point, you picked up healthcare. One of the hardest things, especially for voice AI, it's highly nuanced, highly emotional. Every spectrum of customers you would face there who's interacting with your system. I want to know why you picked up that space.
So there is that like emotional crap of a reason which I would not give here. It's mostly business, I would say, because in healthcare we realize that there is a big gap between patients, and I would say the right kind of care being delivered, and it's not anybody's fault. Our doctors are overworked, our healthcare practitioners like nurses are overworked, patients, because India is a populated country, patients need that care but they don't have access to it. If they get even even a pinch of a support, that's enough for them. So that's where we felt AI agent could come in. And apart from that, in terms of complexity, healthcare is such a complex thing that everything is so siloed. We believe that if AI agents can't add value here, then they should not exist. Like there's no value add actually. So as a business, it was a very logical decision that there is a customer who requires such a support. There is a business who is willing to pay for it because they care for the customer. And also we get to develop a very deep moat as a company, as a startup. So that's why.
Can you think of one patient or clinic interaction, that really surprised you?
There were actually plenty. During the initial days, I used to go and shadow oncologists. When we started, one specialization which we were going after was oncology. And fortunately, that was the first time when I had to shadow someone. And fortunately, I was on this side because when I saw the patients, that's something I was like, that was very touching to me. We saw that there were patients who were coming from hundreds of kilometers away just to get an appointment, and then finding out that doctor would be late because there are anyways pending appointments, and waiting there for 4 hours, and that too in a critical situation. So those moments, they are not particularly related to voice AI, but mostly around that how big of a gap there is in terms of care being delivered. That was very emotional to me, and especially the kind of disease oncologist deals with, that's very heartening. So yeah.
Amazing. So I believe that solidified your resolution to build it in this space.
Yeah, like you as a founder, you kind of, after few MVPs, after building few vibe-coded tools, you try to look for something which you can do for like probably longer, because money is anyways not coming your way anytime soon. So you're not going to get like millionaire or billionaire anytime soon. So you look for like real problems which you can basically spend your life on. So this was something for me.
Sure. See, talking is one of the natural form in which we as humans communicate, right? So when you think about the actual human way in which we talk, there is like pauses, there is I talk something, then I stop, think about something else, and then do that. I interrupt a lot when I talk, switching languages mid-sentence, all of that. Now, the same things transition when they speak to a voice agent as well. Now, which of these do you think is hardest for the voice AI to crack as of today? And what part of this worked exceptionally better for your agents that you built?
If I start telling you all the parts where it sucks, I think this like 3 days would be short for that. But essentially, you're very right. Like when we talk, our brains are like, I don't know, they're like so well trained or what. But the way we talk is it's not sequential. We jump around things, we jump back. I'll tell you an example actually. So we used to do these surveys where we would ask a patient to rate their score. Like it's a quality of life survey which typically an oncology patient goes through. We used to ask them that could you rate your score between 1 to 5? And our assumption being like an engineer was people would say 2 or people would say 3. When we actually rolled out this bot, people were saying between 2 to 4. Now as a human you could understand, you would still be like that 4 is more painful, so patient is feeling 4. But AI it can't, because it's actually not intelligent, it's word association, it's logic that way. So there is still a big gap on how voice AI can still tackle to patients. So where we stand, we are very clear on this that voice agents can't solve everything. We can't like replace even single person in a hospital. What we can do is, there are certain workflows where these existing doctors and other healthcare practitioners waste time. We just want to free that up. So that's where we are building our agents, that you at least do this minimal job which other important people don't want to waste their time on. You don't take away like whatever they're doing because they're best at it. So I think just understanding that way is where you place your product. That makes a big difference.
Understood. Now let's talk about the hype. If you're building in AI today, people assume that everything is sorted. I mean, AI can do everything. And then the deployment day happens and they feel, oh, this is not working, that's not working, this is not what is expected. So what is that one big misconception that you have faced when you showcase your product and then it goes out into production and they come back and say, oh, this is not what it was. What was that one big misconception that you faced?
I think there is a big misunderstanding about how we perceive AI right now. We have started perceiving AI, and this is my humble opinion by the way, but we have started perceiving AI as if it's like an alternative to us, but it's not. It's more like more like extra added arms to us, right? So basically what I was trying to say is there are things which actually I'm not finding the right word for it, but there are things which AI can't do properly, which like a person needs to step in. That's where like demos go wrong, right? Because when you sign a deal with someone, they feel like it's AI, so let it take care of everything and they will just be out of it. But that's not the case. It's more like we are building something together, and more than SaaS, it's especially true for AI that you co-develop it with the customer you are deploying it for, because they have this business expertise and you have the tech expertise, and then you deploy it, then it works. Otherwise it would not work. So that kind of gap in the misunderstanding that you give everything to AI and it will work 100% of the time, that I believe is the biggest reason why most of the demos POC does not go as planned. If you have the expectation right from the beginning, then you have much higher chances of getting successful.
Cool. That was about the business end of it, but let's talk about the people who actually interact with your systems. What really matters for them? It's not is it the accuracy? Is it the tone in which your agent interacts with them? What really makes them feel, okay, this, even though it's an AI agent, it completely understands me, it makes my day easier, work easier. What do you think that aspect is?
Is it particularly for us or in general, like how people should think about it?
For you, in voice AI?
I would say like we are very simple people, so this logic could also be applied by anyone here. So it's more like it's a tool. AI is a tool which you need to use for something. And I'll tell you why I'm saying this. Let's say you have built a bot which just takes appointment for a hospital. Now it could be very transactional thing that somebody wants to book an appointment, you take that and you get done with it. The tonality, empathy doesn't matter there. Now a similar voice agent is getting used for, let's say, something related to oncology. In that case, you need empathy. You can't do it without it. So what we do is we have custom designed our workflows. We have fine-tuned our model in that way that it only works for that particular workflow where it delivers greater value. So it's more around like how you bifurcate and how you kind of prepare for that workflow is what kind of makes us outshine. And I believe like that's the right way to go about building any kind of AI agent.
So there's a lot of customizations based on the particular use case that you got it.
Yeah, I would say because we feel like AI agent deployed once could do everything. That's not the case. It needs to be customized properly. It needs to be tested properly before it goes live. Because like as they say, it's not deterministic enough. That means it's not like 2 + 2 is always 4. ChatGPT throws out different answer for the same question. So it needs to be tested enough, and then only once you are sure with beta users, you can deploy it. That's when it works. So knowing that and preparing for that your POC would run for 2 months. You can't say that I'll go live in 1 week. That's not going to happen. You will only lose credibility at the best case. So yeah, preparing for it, knowing what you're going to deliver, setting right expectations is what I would say makes us work so far and could help anyone building AI agents.
Cool. So this is a bit of a prediction sort of question. So voice AI right now is in a very nascent stage. Companies, hospitals are implementing it, there are service centers, customer support which is implementing it. But do you think, I'm just asking your prediction for the next maybe 2 years down the lane. What will be that one thing that, people, it would be very commonplace for them, an interaction with a voice AI component, that they wouldn't even notice that they are talking to an AI, and it's like very natural. What do you think that one aspect of their day-to-day life, be it interaction with an appointment booking agent or anything, that's going to change in that? This is going to be a norm from then on.
I would say IVR will go away.
ideas will come.
I don't see IVR existing like even few months down the line. Secondly, I think now companies won't have a reason to not provide good customer support or patient support, because now they have tools. Patients are not asking for someone empathetic or like caring to listen. They just want their work to be done. They just want their like bill discharge summary to be given to them, emailed it to them. Agent can do it. So now these companies or these hospitals, they won't have a reason to not do it. So that customer patient experience should definitely go up. Secondly, a bigger theme which I see evolving is like there are many places where we have to talk, but we essentially don't need to. I think that's where agents like these kind of voice replicas of ours could come in, and it will become more like, for example, if I have to call someone and I have to wait for 20 minutes and then like talk, I would rather use AI as my assistant to wait for me, and when the wait is done, I can jump in, just get the work done and step out. So you see like that kind of transactional interactions, I would say, go up. So voice agents would sort of become sort of an API. I know we promised not to go technical, but I can't find a better word to describe it. But it's like it'll make your life easier, doing all the redundant work for you, acting as your assistant. I think that will come in as a human behavior. That me personally and every individual of us would start delegating more nonsensical things to AI, that you do it. You just pull me in whenever it's needed. That kind of behavior would come in, I believe.
Amazing. To that, we came to the end of our session. We are right on dot on time. What I love talking today was we didn't talk anything technical. It was purely from the trenches stories from founder to founder, and it was amazing. Thank you so much, Dhruv, for taking time coming here, being part of Huddle. Thank you so much, and thank you all of you for being an amazing audience.
Thank you, guys.